This World Cancer Day, which is, of course, the 4th of February, Eastern Health is shining a light on the compassionate care provided by clinical professionals who play a crucial role in supporting cancer patients and their families. The day serves to highlight the importance of early detection, prevention and treatment, as well as the need for increased funding for cancer research. It's also an opportunity to unite people from around the world in the fight against cancer and to advocate for policies that improve access to quality care and support for those affected. Acting Clinical Director of Oncology at Eastern Health is Dr. Danielle Ferraro, and she joins us right now. Daniela, good morning.
Good morning. Lovely to talk to you.
Look, cancer treatment is incredibly complex. There are so many different types of cancer. What are some of the key challenges faced by your team in providing specialised care for patients undergoing cancer treatment?
You're right. Cancer is a really complex area, and I think the more we know about cancer, the more complex we realise it is. I think what we've learnt over the years is that cancer is a multitude of different subsets rather than one big similar group of diseases. So each cancer is driven by different mutations or different changes, and trying to find what they are and then find targeted treatments that work best for those has been a real challenge, and certainly the focus of lots of attention around the world in terms of research. You know, we see patients who also have lots of other medical conditions that are challenging for them on top of their cancer diagnosis. So trying to make sure we find the best treatment for the best patient at the best time has been a really challenging exercise, but hopefully with research and over time, and certainly the dedicated efforts of a huge number of professionals, we're incrementally improving outcomes for patients, which is ultimately what this is all about.
Look, undergoing treatment for cancer and the whole cancer journey as a whole, all the way from diagnosis, is taxing, grueling, emotionally challenging ordeal. And I know this firsthand because I lost my wife to neuroendocrine cancer 8 years ago. Look, it's more important than ever that practitioners really try to adopt a holistic approach to cancer care, isn't it?
Completely, and I'm sorry to hear about your wife. It's certainly an incredibly difficult journey for patients and their carers and their families and their loved ones, and often their bigger network of supports as well. And hospitals are good at medical care, but I guess historically we've sometimes not been great at those other supportive measures, but it's been a real focus. At Eastern Health, we try and be as holistic as we can, and I think our clinical nurse consultants are an excellent example of this. They've been invaluable in helping patients as they work through what's often a very scary and confronting medical system if you've not been involved in it before. So we're really lucky to have such an excellent team here to try and make the journey as manageable as we can in such a difficult time.
Look, I think education and awareness is vital for patients and their families as they go through the whole thing. How does your Eastern Health Service approach that education and service improvement to the overall quality of cancer care?
So we're very careful about making sure that our treatment policies and the way we manage cancers align with best possible practice. So it aligns with Australian and international practice, and we're constantly reviewing that. In terms of our, we work within all our Australian guidelines as well, and we have very multidisciplinary collaboration to make sure that we're all in agreement with treatment plans. In terms of education and support, again, our clinical nurse consultants are excellent from this point of view because they are really able to journey with the patient through every step of this and keep them informed about how the system works and how they're progressing. It's certainly a challenging area with patients who have so much going on, and it can absolutely be overwhelming. So hopefully, there's definitely always room to improve, but hopefully we're really championing patients at the forefront of what we do and making sure their experience is
well, as good as it can get, and it can be very difficult. Gee, it really does. Look, we spoke to the Cancer Council back at the beginning of the program this morning, and they said Australia really is at the forefront of many of the advancements being made in cancer treatment and care. How has that changed in Australia over the last decade or two?
So we certainly are involved in a lot of local and international research. Research costs a lot of money, and that can be tricky to try and balance a number of priorities, obviously, within the healthcare system, where we certainly, I think, have expanded our collaborations internationally. We have lots of doctors who have worked and travelled overseas. And so we've become, and technology makes it a lot easier these days too, to work collaboratively internationally on clinical trials. We've had lots of new drugs that have appeared, and obviously we work within the limits of our funding system for those, but we certainly have access to some of the best medications available for cancer treatment. And I think some of the best doctors around too.
Exactly. Look, on this World Cancer Day, what can we and the general public who may not have direct contact with cancer patients, what can we do to mark the day, to help out? What can we do to help, if you like?
So I think probably the first thing is to be mindful of our own health. We all know the easy to say but hard to do things about good diet and exercise and not smoking. I think it's about being mindful of one's own symptoms, things that are not right. The sooner we catch most of these cancers makes a huge difference to outcomes.
Yeah, early detection.
And in terms of the people we know with cancer, because we're likely all to know at least one person who's going through a cancer journey, it's about, I guess, showing support. And it may not be, being deeply involved in their journey, but knowing that the people around them are supportive and understanding what they're going through, I think makes a huge difference for the patients we see.
Danielle, thank you so much for coming on and speaking with us this morning. I appreciate it very much.
A pleasure. Have a lovely day.
Acting Clinical Director of Oncology at Eastern Health, Dr. Danielle Ferraro.